So meanwhile, Dr. Richard Lessells, a leading infectious diseases expert, has admitted that scientists may have been wrong in thinking the Delta variant of the coronavirus that causes COVID-19 would not become the dominant variant circulating in South Africa. The Delta variant was first discovered in India in October of 2020 and has come to dominate new COVID-19 infections around the world. The strain is more transmissible than previous variants, but has not yet been shown to cause more severe disease. A group leader at the KwaZulu-Natal Research and Innovation Sequencing platform, KRISP, Professor Lessells, said that vaccines were the only way to curb the ever-mutating and evolving virus. He joins us now. A very good evening to you, Dr. Lessells, and thank you so much for speaking to us. So tell me, why is it that scientists never thought that it would be the dominating variant?
Well, just to be clear first, when I was talking there, I was talking about myself. So this was a kind of personal reflection that I had thought that it may not take over so much, because if you'll remember, we had the beta variant that kind of drove our second wave, and then it remained the dominant and really became fixed as the variant that was causing all the infections in South Africa. And we weren't sure whether this Delta variant, if it arrived in the country, whether it would be able to kind of replace the beta variant. And there's lots of technical reasons why we kind of thought that, but what's clear now from the genomic surveillance efforts all around the country in the genomic labs is that the Delta variant is now causing a large proportion of the infections, and it does seem to be kind of displacing the beta variant that was previously.
Are you able to share with us some of those technical reasons, obviously making it more accessible to us, the layman?
So I think initially we weren't sure how much more transmissible the Delta variant was than the other transmissible variants, the other variants of concern, like the beta. And so that was one reason why we weren't sure whether it would kind of come and take over all the infections. The other reason was we weren't sure whether people that had been infected with beta, so people infected in the second wave, whether the natural immunity they had would fully protect them against infection with the Delta variant. And so these were parts of the reasons that we thought perhaps the Delta variant would not come and completely take over. But we now have good data to say this is highly transmissible. It's much more transmissible than any of the other variants of concern. And that's why it kind of takes over the infections.
Okay, so just remaining on that drawing board, obviously government relies on a surveillance network for the early detection of different strains of the coronavirus that are circulating. So that would include scientists such as you. But given the fact that outside of a host, a virus is dormant, how does that surveillance work? How are you able to detect some of those things, such as virulence?
So I'm not quite sure I'm getting your question. I mean, the surveillance network is a genomic surveillance network. So that's where we do the genome sequencing of the virus, and that happens in a network of specialist labs all around the country, in the NICD, in UKZN here, UCT, Stellenbosch, and Free State. And we take samples from public and private laboratories from the positive PCR tests, and we generate a sequence of the genome. And then we can understand which variants are circulating in the country and causing the infections.
Okay, so I'm asking for precisely that reason, Dr. Lessells, because I understand that there was a study in 2014 that a virus was frozen in permafrost for 30,000 years, that scientists were able to retrieve it and infect an amoeba, and then it was revived. So I'm just trying to understand the cycle of a virus. So that would make you say this is more virulent, this is why we think that this would be the more dominant variant.
So it seems, so it's really about the transmissibility. It's really about how efficiently the virus spreads from person to person. And you see that play out at a population level. And really it's through linking the epidemiological data and the genomic data that you can start to understand the relative transmissibility of these different variants. And that's what's showing us that here in South Africa, the Delta variant is clearly more transmissible than the Beta variant. And if you look over to the United Kingdom, what you've seen there is the Delta variant completely replace the Alpha variant. That was another variant of concern that was completely dominant in the UK until a couple of months ago.
It's been said that the coronavirus has somewhat of a proofreading protein, that it is able to fix errors that would happen during the replication process. What exactly does that mean? We've just had our colleagues giving us a report of there are people who don't believe that the coronavirus is serious. So just tell us about the science and why we need to take heed of this. The fact that it is even able to fix kinks, so to speak, as I said, in the replication process.
It can, but as it's spreading so efficiently and so rapidly from person to person, mutations still occur. So even though it has this proofreading capacity, as you say, these mutations still occur as a natural process. And then what we see is that these variants that have certain constellation of mutations, they then, if they have a certain advantage, whether that's transmissibility advantage, or maybe they're able to evade parts of the immune response, like we saw with the Beta variant, then these have a transmission advantage in the population, and so they start spreading more than the other variants. So the fact that the virus has a proofreading capacity doesn't stop these mutations from happening as it's spreading so rapidly through huge numbers of people.
It's also been said that data tells us that the Delta variant is less resistant to neutralization than the Beta variant. So this, you said, is good news for the vaccines that we have received and may be receiving in future.
Yeah, and I think more than that, we can now see very strong data from the United Kingdom, where, as I say, the Delta variant has completely taken over, and they're now obviously at a high coverage of vaccines. That data can show us that as these vaccines are being used routinely, given to the whole population, they're showing very high levels of protection against severe disease. And that's hugely important, and that's what we call kind of effectiveness data. So it's not coming from a clinical trial, it's just coming from the routine rollout of the vaccines, and showing that in the face of this Delta variant, the vaccines are holding up very well.
Okay. So not to be alarming, but you've said that the next variant would be difficult to predict and that slow vaccinations in different parts of the world are a problem for the entire world. Can you explain this to us?
Well, in simple terms, unfortunately, these variants are going to continue to emerge and spread in different parts of the world. And that's going to happen where vaccination coverage is low. And at the moment, the place with the lowest vaccination coverage, the continent, is Africa, and we are lagging considerably behind the rest of the world. And as we are dealing with these highly transmissible variants now, what that means is that it's harder for us to slow the transmission down, to control the spread of the virus. And so we're kind of creating the perfect storm for the continued emergence of new variants. And as I said, that's taking a huge risk because we don't know what properties the next variant of concern might have. So we really need to focus on the fact that this is a global pandemic, and that's why we keep making this point about vaccine equity and fairness, that we need to accelerate the vaccine effort in the parts of the world that are lagging behind.
Thank you so much for speaking to us and sharing your insights, Dr. Richard Lessells, Infectious Diseases Specialist at the University of KwaZulu-Natal.